Welcome to the Capital Spine and Pain Center's Patient Video Series. Our board-certified physicians are committed to helping you better understand your condition and the non-surgical treatment options that are available at one of our many clinics throughout the Washington, D.C. area. We've created this series of patient videos to help you find the answers to your important questions about acute and chronic pain.
Spinal stenosis is a condition that develops gradually as we age. This is a narrowing of the spinal canal, which is a channel inside the vertebrae. This channel runs from the base of the brain all the way to the bottom of the spine, and this channel houses the spinal cord and the spinal nerves. Spinal stenosis develops in older people because of a slow degenerative process, which is called osteoarthritis. The intervertebral discs, which are cartilages, degenerate, and as they degenerate, they bulge out. And also, the lumbar facets, which are situated in the back of the spinal canal, grow bigger, and so do some specialized ligaments. And as a result of all this growth, the spinal canal becomes significantly narrower. In younger patients, typically the spinal stenosis develops either because they have a significant scoliosis, or they have a shift called spondylolisthesis, or they are born with a narrower canal, which is congenital spinal stenosis. In the lumbar area, spinal stenosis is more prevalent at the L3, L4, and L4, L5 levels. Spinal stenosis can also develop in the cervical spine. Fortunately, spinal stenosis is a slowly progressive disease and typically does not produce any significant neurological symptoms. Most of the patients have a benign evolution throughout their lives. The typical symptoms of spinal stenosis are buttock pain and leg pain, which are aggravated by standing and walking, and they are relieved by sitting down or lying down. Some patients might also have low back pain. In some cases, people can have numbness, tingling, and weakness. It is important to see a doctor for this condition because other conditions mimic the same symptoms. Here at the Capital Spine and Pain Centers, we have an extensive history of dealing with this condition and of ruling out other conditions such as peripheral vascular disease, polyneuropathy, and polyarthritis. The diagnosis of spinal stenosis requires an MRI, which actually shows the size of the spinal canal. In addition to the MRI, a clinical examination is important in order to rule out any neurological signs or weakness. An EMG nerve conduction study can also be quite helpful in the sense that it will show if the spinal nerves are suffering or not. Typically, spinal stenosis can be treated with conservative measures such as selective epidural injections and physical therapy. In a minority of cases, when the patients have weakness, spinal surgery might be necessary, and this surgery can involve extensive laminectomy, cutting off the bone of the canal to enlarge the canal, and possibly even fusion. A conservative treatment should always be tried first, and here at the Capital Spine and Pain Centers we have been extremely successful by using a specific epidural injection, which is called a selective epidural injection. These injections are done under direct fluoroscopic control, and they are very exact. Most of the patients improve after this treatment. Typically, patients will be treated with these epidural injections repetitively, but not for more than 3 injections in a row. Some patients respond very well to this approach, but in some other cases, the pain comes back, and in those situations, those patients will require that injection every 3 months.
For more information about non-surgical solutions for pain relief, call us at 703-914-8000 or visit our website at www.treatingpain.com.